the first expectation is that the EMS provider recognize that even though it's a healthcare facility, it first and foremost is a person's home. And so that's an important conceptual thing to keep in mind. And so we'd expect that when EMS providers enter our home, that they treat all of us with the respect that we would expect in our own home. I think that there's an old saying that says when you've seen one nursing home resident, you've seen one nursing home resident, and that's certainly true. I think that one of the expectations that we have is that providers recognize that each resident may be different in terms of their medical needs, their functional abilities, and what the ideal interaction with an EMS provider is going to be. And so individualization of care and interaction is going to be really important, kind of not formulating a preconceptualized idea of what's going to happen when you get there. I guess I would say that the vast majority of our encounters are very positive interactions with EMS providers. They bring to our facilities a skill expertise that we don't have, and especially in light of some of the limited staffing and limited exposure that our care providers have to some of those realms, we're always very grateful to have our EMS providers present. The interactions that we've had that we feel like have been the most successful are usually characterized by a good two-way exchange of information. And so the things that I would say have contributed to those interactions are good listening, so that when care providers at the nursing home kind of have something to say about their resident, that the EMS providers have really dutifully listened to that and taken it into their own professional assessment. The other thing that I would say was really important was that if they needed something, they asked for it specifically. I think there's some limited experience of a lot of nursing home providers to the actual professional role of EMS providers, and in some cases there's been pretty limited exposure, and so people who are working in the nursing home or living in the nursing home may really not have a good understanding of what EMS providers need to be successful, and I think when people have asked specifically, that's really helped communication be good. On the other hand, like any healthcare system interaction, there's always a few circumstances where you really have seen opportunities for improvement. And I think the situations that have been most frustrating to us are ones where care providers in the nursing home feel like they have valuable information to impart, but that it's not being heard. The other example that comes to mind from my own personal care patients is circumstances where we've had concerns about a resident, for example, if they had significant abdominal pain that was different than their normal scenario. There have been circumstances where we've sent patients like that out to the emergency department for a quick emergent evaluation that we weren't able to offer in the nursing home. I can think of a few examples of en route those people being kind of given diagnostic impressions that markedly differed from the care providers in one facility. And it's not a right or wrong situation, but I think that the resident in those circumstances was kind of caught in the middle, so that they didn't have a good sense of whom to trust or where in the evaluation they were. And so opportunities to really kind of be on the same page with providers in the nursing home have been helpful to us.
I go in with a smile. I think if you start off the interaction positively and go in and try to have a positive, that generally that's what you get back. If you go in with an attitude, you're going to get an attitude back. And so you go in and you smile and you say thanks for everything and you be polite, and instead of demanding something, you ask for help and stuff like that. I think that is like a big would be my biggest advice, and that's what helps me out, I think, is just trying to be pleasant and not necessarily demanding, but asking and regular old manner stuff.
I guess the first message would be that a thank you message. We really appreciate the services that they offer to our residents in getting them promptly to care that they need. The second advice or tip that I would give is keep in mind that nursing homes are becoming very specialized sites of care, and so while we really strive to give the best care possible there, we're really kind of micro-specialists in our own environment. And as such, we kind of hope to be treated with the same respect that any other healthcare provider would be. I think we all have the same goals as a team, and so if there's ways that we can help you, please let us know.